Hello everyone, welcome to Across the Wave. Across the Wave is a gambling recovery program that is created to promote awareness on compulsive gambling and also to create responsible gambling in Nigeria and across the world. Across the Wave is brought to you by Gamble Alert. Gamble Alert is a not-for-profit organization that is formed to advocate for responsible gambling, prevent underage gambling, provide mental aid for bettors to cut out impulsive betting, and also to provide clinical and rehabilitation assistance for addicted bettors. On today's edition of Across the Wave, our guest is Dr. Salawu Abiolo, who is a senior registrar for Drug and Addiction Unit, the Federal Neuropsychiatric Hospital, Yaba, Lagos. With me also is my co-host, Damilola, Amao. Now let's dive in. I'd like to ask, we had some times ago someone who was just recovering from compulsive gambling. We questioned this person, and this person said, well, when he is emotional or when he's under stress, to take away that stress, he likes to gamble. Now, you are a practitioner, you're a professional. What do you think is the relationship between stress and mental health?
All right, so let's just clearly, the statement that you actually make. All right, so you actually made mention about, stress and gambling. We definitely talk about stress and mental health, but stress and gambling. Fine, the people that gamble, they actually most times they look for a reason, to actually defend their their activity. So looking at it, they may give reasons, okay, because of stress. And when you look at gambling, initially when they start gambling, they gamble because of the reward. We actually call it positive reinforcement. But when it gets to some extent, it becomes a compulsion. Most of them, if you look at it, okay, those that have sold a lot, they keep on losing and they keep on betting. So you wonder, is it because of what they gain? You start questioning, like, I don't really think it's because, so as at that point, it becomes a compulsion. They are doing it to relieve, tension and, a lot of things that we building because it has now become a compulsion, what they have to do to feel better. So that person that is telling you is actually at the point of compulsion, Then looking at it, generally mental health and stress, yes. All right, we actually say, okay, stress, is a equally predisposing factor to a lot of, illness. But what we should know about stress is that sometimes we could have, let me say, good stress and bad stress. You understand? We say positive and negative. There are a lot of theories around that have, talked about stress and performance. Because when we are stressed a little, we tend to do, good. But when we become too stressed, because everybody has their own limit. It's just like a rubber you are trying to pull. Yes. When you exert too much stress on what happened, the wire, the rubber breaks. So that's how stress is. Everybody has their own capacity. So when stress is too much, it's actually not good for the mental health. People tend to break down and come down with mental disorder like anxiety, depression, and what have you.
All right. So what would you say is the psychology behind gambling? Why do people, because you mentioned something relating to that, but I want our viewers to have an in-depth understanding. You were trying to say something as regards that, why really do people gamble?
All right, in fact, okay, looking at that question, yes. People, as I've said, is, okay, the way you said, you say, good, bad, okay, people, as I said, they start it with the aim of reward. Okay. And that's why we call technically, positive reinforcement. That means you do something, you get a reward. Just like a child, if a child goes to school, you give the child a biscuit, the child will want to go to school. So people do it, when I do this, I get a reward. Okay. That's how they start. Okay. You understand? So they keep on doing it, they get a reward. Okay. But as they continue doing it, it gets to a point where when it become, compulsion.
Yes.
You understand? So they have to do it so that they will feel okay. Because when they don't do it at that point, they are not, calm. They are not themselves. And when you look at it, people that gamble, there are a lot of, we call it cognitive, distortion. Like the way they think is quite different. Wow. And one common one we see is this. There's one we see gambler's fallacy. That's what we call it. So when they bet and they lose, yes. And they are coming back to bet again, yes. They will, okay, for instance, you bet, you lose, you bet, you lose. You feel that the winning is coming. The winning is next. You understand? So the more you bet and you are losing, because of the cognitive the problem they have with their reasoning, they always think that the next one, I think I'll win. I think this one is going. So that's how they keep on. They keep on. Before they notice they are, into problem gambling. Wow. And also, when you look at it, the way gambling also reward, there are different type of reward. Yes. We have variable. I don't want to bore you with a lot of technical terms. Fixed ratio, variable ratio. But the way what gambling, how they reward is variable ratio. Yeah. Like for instance, the salary we earn works with fixed interval. Let me put it that way. So at the end of the month, you get your salary. Mm-hmm. So when people get salary, they work a little bit better. After 2 or 3 weeks, everybody gets that, at the end of the month. But gambling doesn't work that way. People don't know when they will be rewarded, as at what event they do when they will be rewarded. So that's why I call it variable ratio. So you don't know, is it the 10th one I will play that will get it or the 11th one? So that, because the fact that it works based on that variable ratio, it makes people to get hooked up. Yeah. You get, because you feel like, this thing is coming, this thing is coming, this thing. So you keep on doing it. I will get reward someday. You understand?
All right, Dr. Salawu, you mentioned something while you were explaining something my co-host asked you. You said people always find themselves going back to betting, which is what brought me to this question. Psychologically, the human nature tends to get drawn to things that makes them chase after them. Like, we don't accept defeat immediately. Let's just go a little bit outside the box. When a man is chasing after a lady, some people will say, when you give him stress, it makes him eager to pursue more. Like, you cannot tell me no. You understand? Now, for gamblers, when they bet the first time, for even the sophisticated people, like the very responsible people, gambling can be responsible too. Which is what we are advocating. So now, when they find themselves going back, probably they just guessed that, okay, this is a particular number or something that I feel would win. And this is very close. Let's say you guessed 2.5 and then we had 2.4. That's very close. You're close to winning, right? Yeah. It is still normal, psychologically, and as our nature, as human, we don't give up. We take risk a lot. So you always want to let me try again. Let me try again. Because normally you will say you don't give up easily, not because it is bad. Giving up easily is also not good, So now for gamblers, they also tell you, but I'm very close to winning, 2.4, 2.5. Let me try again now. No, this life is all about risk. Let me take the risk. Okay. So in that aspect, at what point do you draw the line so that it won't affect your mental health?
All right. Thank you for the question. All right, so just as you said, we always, women, want to take risk. Fine, all right. So, fine, it's normal. Okay, let's try. If I even life itself, it's a risk. You understand? All right, so, but when we look at gambling now, you said something that one we said was actually, okay, when they are close to the target, it's actually called a near miss. Yeah. They call near miss, you understand? The person going back, just as I've explained, talking about, they do it, the gambler, like, the more you do and you don't get it, the more you feel that the positive outcome is coming. So those are the things that make them go. Then also, near miss, even if you have a near miss now when you play gamble, the new one you are playing, the probability that you are going to win is not depending on the one that you've played yesterday. Yes. But then, because of their, the cognitive distortion, as I said, the way they think, they're like, yesterday it was close. Maybe today I will get it. You understand? And today the probability that you win today does not depend on what yesterday's outcome is. So, they have a kind of, let me put it, like a selective memory. They tend to remember things that are looking good. You understand? And tend to not to remember those that are not looking good, like the far misses, as you said. They won't remember the day they've had a lot of far misses. You understand? So, but looking at it, yes, gambling risk. But when this risk is now out of proportion, like fine, we want to take risks. Okay, let me see if. But when this risk is now out of proportion, as I said earlier, when it's beginning to affect the person, like, why are you taking this risk? Is this risk really worth it? You know, and then you can say, wow, this is actually, a gambling disorder.
Let me ask, being the person working in the drug and addiction units in the Federal Neuropsychiatric Hospital, Yaba, Lagos, what's the comparison between a gamble addict and a drug addict?
All right. So, okay, just as gambling is more like it's a social engagement. Okay, let me guess, let me make money. You understand? But when you look at drug, people actually take something into their body, into their we call them psychoactive substance, into their body to get one or two feeling, and as a problem, it becomes a problem with time. You understand? When they get high, they notice that they keep on going back. They do everything possible in their life to get it, and taking the drug becomes the most important thing. They don't value just, let me just be on this drug. You understand? So looking at it, all in all, they are all, let's say, they are all addictive. They are all addiction. Let me put it that way. But will I want to say drug is more? I don't know how to say it, but let me say it's worse, but not really worse, because it's worse. Fine, we know. But when we say, when we look at individuals, especially when we treat individuals in the mental health place like this, we actually try to individualize their care. You understand? So what I'm trying to say is that you may be gambling and I may be, taking psychoactive substance, but you may experience more harm from gambling than maybe I do from psychoactive substance. So that's why actually we don't want to say. But looking at it, psychoactive substance also has, physical, it can also affect the physical health. You understand? Because those substances, they also cause damages to the body. You understand? Where in quotes we will say maybe gambling does not cause damage to the body, it can also maybe as a result of accidental issues. But when we look at it directly, you understand, physical damage to health may not be the case when you look at gambling. You understand, as compared to, so like substance is a little bit, and to be sincere, substance is also a little bit, quite, worse. Let me put it.
Before I leave you to my co-host here, let me just ask you this particular question. Now, statistics shows that 14.3 million Nigerians take drugs, maybe out of prescription, but 3 million Nigerians tend to abuse it. So, as a medical practitioner, what are you doing to sensitize people about, eradicating drug abuse? What are you doing to sensitize people?
So, all right. So, I would, okay, just as you say, your figures are quite high when you look at the population of Nigeria. Yeah. It's quite a high percentage. And I would agree with you, because even from the hospitals, a lot, yes, we actually see people with, problem with drug abuse. All right. But the things we've been doing, fine, we actually look at, in the primary level, like, okay, before these people come here, most of the things we do, we try to hold, seminar, we have one or two weekly programs, we even have the Yaba voice, not only directly to substance use, but to all topical issues in Nigeria. And also, even, I think yesterday, on Wednesday was the drug abuse. We had a program too to mark the World Drug Abuse Day. So those are the things, in our own capacity, we're actually trying to at least enlighten the public. And also, when they come to us, we also try to, treat them appropriately, at least so they can go back and function where they are coming from.
All right, thank you very much. Because I was trying to bring the discussion, I was trying to narrow it down to the industry. So, the industry of gambling also is fast rising in a country like Nigeria. And if you go online now, you could virtually see most youths with their phone. They just make a gamble, and it's very easy because of technology. Yeah, so we are concerned, and I think she asked something similar to that. If there are special intervention, or if there's point where we think, oh, a special intervention should come in. But I think you just highlighted something similar to that. But then, because of our audience, I want to ask something very special, and it's about gender-based. Now, when it comes to gambling addiction, problem addictions, would you say male, it falls to male most, or it falls to women most, or it falls to women most, but these are the kinds of factors that propel, these things to be more to women? Or would you want to say something around that?
All right, so, okay, generally gambling, it's just even when you go to places that they gamble, you actually see more males there. Even whether especially when those ones that goes to the shop, So gambling disorder is actually much commoner in males than women. But now they say what a man can do, a woman can do better. So I will actually agree with you now. With time now, the trend now is that women are also, they're also gambling. They also now serve with the responsibility. Everybody is trying to, let me try to, because of the reward and other things. So I would say that now the trend is that, women are, are now, the prevalence is now, coming up in women too. But for now, males there are more male gamblers when compared to females.
Okay, just to add to what you just said, I play video games. I play video games in my house, with my laptop, with my and I understand that there are some children who also does, and sometimes I have studied myself that 2 hours, 3 hours, I was playing a video game. Now, these are small kids, these are kids rather, who are home and they have video games to themselves to play, and they can play 14 hours, they can play as much as possible. Do you think there is a measure that should be taken by the parents, or do you think these acts of permission where they have 14, 15 hours to just play video games can lead to gambling? Don't forget that gambling is not necessarily, there are different forms of gambling. In fact, if you remember when we were kids, there is this rubber band we throw, it's also a form of gambling. So do you think that process could lead to gambling, and what measures do you think parents are supposed to occupy?
All right, so I think that's a very good question. As you said, you play video games for limited hours, and when the children play games, they tend to spend more time. So I think to actually understand this, especially for the parent at home, they need to understand the way children think and their development. You understand? As at that point when people are still much younger, their brain is not developed, you understand? Because there are different parts of the brain. I don't want to use something. The brain develops from the down. It now goes up. The higher centers develop later. You understand? And it's that higher center that puts control, that will tell you, you've been playing game for 3 hours. Go and do something good with your life. But when you look at children, that higher center is not developed. So that's why you see that they engage in activity that is rewarding, and they just keep doing it. They don't even care. You understand? And when you look at it, spending a lot of time playing video games is actually not good. I personally believe that those times that a child spends at home is when the mother or the parent is supposed to instill morals into the child. You understand? Because, when you look at our busy life now, by 8, child goes to school, child comes back by 4, and child is spending a long time playing. It's those periods you're supposed to be with your child. Like, what did you learn at school? This is how, you understand? So those are the periods they are supposed to use to instill morale into your child, you understand? But when you leave the child, you're more like a kind of a neglectful parenting. And that could actually come out with, not even gambling this time, even a lot of mental health outcomes. And when we now look at the game itself that they are playing, maybe you are not aware that there is actually game too is addictive. Yes, there is. In fact, in our diagnosis, we have gaming disorders too. Wow. Yes, predominantly online and offline. So gaming too can be addictive. Yes, I will say a lot of people too, that as in people, especially more in the Western world, let me say, that they actually have disorder, which is as a result of video game. You understand? And also, an addictive behavior. So with this, I think parents should try and limit. Fine, game, they will help to relieve them of stress, but it should just be for a limited time, not for quite long time.
Okay, just before I let my co-host take over, you said something that I'm very interested about for a limited time. Now, we are letting people know that we are not outrightly saying that gambling is bad, because gambling is, in Nigeria, for example, let's come to the perspective, is an entertainment. In fact, the industry lets you know before you gamble that understand that this thing is for entertainment's sake. You win, you lose, don't kill yourself or anything. It's just for entertainment. It's just for you to have fun. But you said something very striking here. A kid begins to play a game, you know, for the sake of entertainment or for the sake of play or just to have fun or something. How, and when you started, you also explained clearly that the brain, the way the brain functions, I want to try again because of risk factor. I want to try again. I want to do it again. Now, how do we balance this such that, is there a measure that we can implement that can help me? For example, I'm not addicted. This is my first time of gambling. Is there a measure that can help me that, oh, I gamble? What can always be that prompt? I don't know if you understand. It's technical, but something that can help me, because from your explanation, the brain wants me to try it again. Yes, but is there something that, because these people who are watching us, our viewers, we need to help them. They understand that, oh, gambling is entertainment. But is there something that can help me know that you are crossing entertainment to addiction, you know, just to help the people who are watching us, our viewers?
All right, so
sorry, doctor, we just want to balance it. That we are not saying gambling is, or the industry is bad, because of course the industry isn't great for the country. But then we also want to help the people who gamble not get, you know, to that line of addiction. And that is why we are doing this program. But as a practitioner, what would you say?
all right, so as you've clearly stated, you said 18 plus. Let me put it that way. At least gambling, we see most of them, they will say 18 plus,
yes.
Right?
Yes.
All right, so that's to show that, okay, at least that 18 plus, the person actually has some level of development in terms of, as I explained earlier, the brain. The person is at least has attained some level of maturity, let me put it that way, both, you know, legally, physically, and mentally. We know that, yes, the person has attained, you know, a level of maturity, because, okay, this person should go into, you know, gambling. All right, but when we look at it, just as I said, that when people start that gambling, okay, it's with the aim of, I want to win. You understand? Fine, I want to have entertainment. Maybe you call it entertainment, but to me, I feel like there's something, there's a reward coming after that entertainment. So that's because of the reward. Let me put it like that. All right. So when this activity now is now, because let me say there is gambling, and there is gambling disorder. I think that's a better way we can understand it. Fine, there is gambling. Whether gambling is right, whether gambling is wrong, it depends on each and every one of us moral. Some, when you look at religion and something like that, so let's leave that one. So whether the gambling is right or wrong, let the audience answer. All right, but what we are not saying is now the gambling disorders. You understand? You know, some people, they call it, some texts call it pathological gambling. This gambling is causing a problem. So that's what the main thing is, those problems. You understand? So when we say pathological gambling, there are a set of things that the person manifests. You understand? The one is that the thing is affecting function in terms of occupation, in terms of social, you understand, in terms of family function. You understand? And we notice that this person, they go extra mile, you know, even with negative consequence of gambling. You understand? They've played, they've lost, they've used all their salary. You understand? They are not winning. And they go extra mile to borrow money. You understand? They still keep on playing. They are not winning. You understand? As at that point, we say, this thing is getting to... If you normally say, okay, I've played, I did not win, I've used my money, you go to the extent of, you know, borrowing money, selling properties, you understand? So there are some, you know, technical criteria that we look at that will say that, yes, this thing is causing a problem. You understand? All right. So I think we should just put it that I think it will be better for our audience. There's gambling and there's gambling disorder. So when it becomes a disorder, you understand, when there's a lot of problems attached to it, you know, it's actually quite significant.
I think I like that, gambling and gambling disorder. That's perfect. Okay, so Dr. Salawu, what method will you recommend for addicted gamblers now? Like, how do you get them out of that addiction? Yeah. We've said everything, but we've analyzed what causes it. We've talked about why you should do the effect of gambling, of getting addicted to gambling and other things. In fact, you mentioned gambling and gambling disorder. You've differentiated it. So now, those that found themselves addicted to gambling, what method would you recommend to bring them out of that addiction?
All right. So, as you said, gambling, disorder now. Yes. Mainly, as I've explained earlier, I talked about some, cognitive, problem, the way they think. Yes. So when we look at the management, most time we'll go more psychological and behavioral first, because we know that the main problem is the way the person thinks. Or some of their other cognitive distortion that they have, but I think we might not need to stress ourselves with that. But mainly is the way they think. Like, why are you always overestimating this outcome? Like, this, I want to, you understand what I'm trying to say? So those are the things we work on in the cognitive therapy, and we also look at behavioral therapies too. You understand, that can help this person. So when we put both, all these things, and we look at the other aspect, the social issues, and also we try to help the person from that angle too. But once most people, they have addiction, yes, there is also a place for medications too that can help, because as you say impulsive, so there's also medication that can help with those impulse, you understand, to make the person less impulsive, you understand. But I'll say that, firstly, we want to try on more of the, psychological measures, you understand, before we start taking, let's now go with the medications. And as I've said earlier, to people that gamble, they may not necessarily have just only gambling. They may have some other co-problems too, psychological problems that you might need to also treat. So that's how we go about it. And the psychological therapy is not a one-off thing, like, well, you just come to them and they will do it for you and you say, go. It's not like that. You come for sessions, session upon sessions like that. So at least one will notice that this person is doing well, So it's not a one-off treatment, it's a continuous treatment.
Okay, so at Gamble Alert,
yes,
I understand that one of our values is that we provide clinical and rehabilitation assistance to gamble addicts. Yeah. And I like the fact that you mentioned there is a medication, because one of our listeners asked a question that, what are the medications they can use, an addict, a gamble addict can use? So for an advocate at Gamble Alert, when we find gamble addicts like that, what would you advise that we do before we bring them to you as a medical practitioner?
All right, so if actually we've established that there is a problem gambling, let me put it that way. All right, fine. The first step you said is actually good, giving advice and counseling. I find it's important. If that's the first thing, try to bring the person in, and then you try to build, what would I say, rapport, let the person believe in you, believe there's a problem, So try to win the person, let me put it that, win the person's heart. It's actually a very important step in the management. But I think after doing that, it's actually important that the person has this psychological treatment, psychotherapy, because psychotherapy is actually more structured, you understand. It's a talk therapy, more like the way you are talking to the person, but it's more structured and it has what it is looking for. All those cognitive errors that they have, we try to address those things, you understand. So that's actually what that psychological, because it's not actually done by anybody. It has to be done by someone that is trained to do it, you understand. So that your first step is actually really good. I'll bring them in. But I think after the whole counseling, I'll leave the person accepts. It's really important to go to the next step. Let the person, come in contact with centers that can help. I think it will really, be important. And
this has really been very massive for me, and I believe our viewers to have gotten quite a lot of information. But before we bring it to an end, I wouldn't know if you have something you want to share with the audience, or you still have something you want to say? Or
Dr. Salawu Abiola has said everything, and I must say I've learned a lot myself, so that in case I find myself in that, I'll know when to cut it. So I think I'll just advise everyone listening right now and watching, make sure you are not just the hearer of the word.